Hello, my name is Dr. John Wessling, and I'm a chiropractor, and I've been in practice here in the Wichita area since 1975. And today I would like to speak to you about dizziness and vertigo. The term vertigo refers to the sensation of spinning or whirling that occurs as a result of a disturbance in equilibrium or balance. Now, it may also be used to describe feelings of lightheadedness, fainting, motion sickness, unsteadiness, and double vision. It may also even cause nausea or vomiting. Now, vertigo is classified as two types. The first is subjective vertigo, and that's when the person feels like they are spinning in the room. And then the second type is objective vertigo, and that's when the person has a perception that the room is spinning around them. Now, one of the causes for dizziness can occur as a result of a disorder in the inner ear. Now, initially, going to your medical doctor is a good idea to rule out any serious conditions of balance disorders such as tumors, strokes, cardiovascular disorders, and brain hemorrhage. Now, medically, you may be diagnosed with an inner ear problem, which it could be caused by the semicircular canals called BPPV, which is benign paroxysmal positional vertigo, which means that you have debris that is in your inner ear, and when you lay down or you turn over, after a few seconds the room starts to spin. Now, at this point, medical treatment may include medications which make you feel better for a short time, but the balance disorder will still be there when the medications wear off. Now, other treatments may include head exercises or Epley's maneuver, which may work in certain cases. Now, in our office, we do use Epley's maneuver with certain balance disorder patients. But unfortunately, when it comes to most cases of balance disorders, medications or exercises simply don't always work. So if the medications or exercises have not resolved your dizziness, it may not always be an inner ear problem. Vertigo or dizziness can be a tricky condition. You see, your dizziness can come from other causes. Dizziness or vertigo also may occur as a result of a disorder to the brainstem, cerebellum, and the vestibular nerve. Now, as you see on this graph here, normally when your head moves, signals are transmitted to the labyrinth, which is an apparatus in the inner ear that is made up of semicircular canals surrounded by fluid. Now, the labyrinth then transmits movement information to the vestibular nerve, and the vestibular nerve carries information to the brainstem and the cerebellum, which are the areas of the brain that control balance, posture, and our coordinated movement. Now, when your cerebellum and your brainstem, cerebellum is located here and the brainstem is located here, when this misfires or malfunctions, then you're going to be dizzy. Now, we have both a right and a left cerebellum, and when one side of the cerebellum is not firing electrical impulses correctly, then the other side is going to overfire up here into the brainstem. Now, every patient wants to know what causes their problem. Now, this is obvious in the case of accidents or injuries, but it's not so obvious in slowly progressing degenerative conditions like dizziness and vertigo. Now, in our office, we take a different approach to the treatment of dizziness and vertigo. Now, during a thorough neurological examination, one of the tests is for your cerebellum. Now, how do we do that? Well, we first of all have you stand with your feet together, your arms to the side, with your eyes closed, and we notice whether or not you are swaying or not. That's one test. Another one is to bring your arms out front with your eyes closed, and you bring your finger towards your nose. Now, if your finger ends off over your cheekbone or up here in your forehead, for example, then we know that your cerebellum is not working correctly. Another test is called pass pointing, which is holding your index finger above your head, taking your opposite index finger and bringing it up and touching it with your eyes closed. If your finger ends off over here or over here, then we know again that you have a cerebellum problem. So these are all tests for the cerebellum. Now, what we tend to see in almost all of our patients with dizziness is a weak or a malfunctioning cerebellum, since the cerebellum, as I mentioned, coordinates balance and coordinated movement. Now, I use brain-based therapy to non-invasively evaluate and rehabilitate the cerebellum and the brainstem, which is highly effective for dizziness and balance disorders. Now, unlike most treatments, like medications, which usually treat the symptoms, brain-based therapy actually treats the cause of your problem. Now, if you're looking for a doctor that is willing to sit down with you and find out about your conditions and see how you've been treated, and who is willing to understand how you feel and provide you with some hope, then at the bottom of this page you will find an area to fill out for more information. We will then send you an online link to a video that will explain all the different treatments that we do that make our care so unique and successful.